In this unit, you will learn common root words for the body systems as well as their prefixes and suffixes. About 90% of our medical words come from Greek and Latin roots. In this unit, you will be breaking down big words into their smaller components. It is difficult at first to learn the root words as well as their prefixes and suffixes, but you will build your skill set layer by layer. In the end of this unit, you will have begun to learn some of the tools to help you decipher larger medical terms. As I stated in the previous slide, 90% of our medical terminology words come from Latin and Greek roots. Medical terminology is made more difficult when both languages use a different word for the same body part. For example, in Latin, we call the tongue linguo. Sublingual means under the tongue. The prefix sub indicates under, and the root word linguo meaning tongue. Greek language calls the tongue glosso. So for example, glossitis indicates inflammation of the tongue. The suffix itis indicates inflammation, and the root word is glosso. In Latin, the kidney root word is reno. For example, renal failure, which means the impairment of kidney function. And in the Greek language, the root word neph is for the kidney. The medical term nephrology indicates the study of normal kidney function, with ology suffix meaning the study of. Not all of our medical terminology words can be broken down into root, prefix, and suffix parts. There are some terms such as cataracts, asthma, diagnosis, prognosis, sequela, acute, chronic, sign, and symptom, which cannot be broken down and therefore are called non-decodable terms. Some terms are called eponyms. These are words that are associated with a person's name or place. For example, the term Achilles tendon is a bundle of tissue that attaches the calf muscle to the heel bone. It is named Achilles for the Greek hero during the Trojan War. Medical terms may have up to 3 working parts. The prefix part may be found at the beginning of the word and relates to the amount, direction, shape, color, or size. The root word is found in the middle and tells you the body part. The suffix portion can be found at the end of the word and can also describe size, shape, color, or even problem. Prefixes and suffixes are modifiers of root words. An example of these 3 working parts is the word echocardiogram. Echo, the prefix, translates to reflected sound. Cardio, the root word, talks about the heart, and gram indicates a picture. Echocardiogram. Next, we will learn commonly used root words for specific body parts. The root word for bone is osteo. Arthro indicates the joints. Myo or sarco may be used for muscles, and oculo or ophthalmo will be used for the eye. In this slide, we will learn the root word for skin is derma. The word odo is used for ears, and nose is rhino, oro is used for mouth. Listed here are additional body parts and their correlating root word names. The root word for heart is cardio. The root word for blood vessels is angio, and when we talk about blood, we call it hemato. The vein is referred to as either veno or phlebo. The lungs are either pulmono or pleuro, and the stomach is gastro. Intestino is the root word for intestines. Thyroid has a root word of thyro. The brain is encephalo, and the nerves are neuro. Kidneys are nephro. The bladder is called cysto. Psycho is used for the mind. Hepato is used for liver. Female is referred to as gyno, and male is andro. The prefix echo means ultrasonic waves. The prefix electro means electricity. The suffix ectomy is for removal, and the suffix for a picture is gram. The suffix graphy is the process of making an image, and otomy is to cut. The suffix plasty is the process of forming or repair. And the suffix scopy is to use an instrument. To see. Stomy is for creating an opening, and the suffix tomy is surgical cutting. This next slide identifies the prefixes and suffixes that indicate a problem with body parts. The meaning of the prefix dis is not working correctly. Mal means bad. The suffix algia is in pain, and the meaning of emia is a blood condition. The suffix itis indicates inflammation of, and the suffix osis is a condition, and pathy means disease. There are a few rules we will follow when combining root words with a suffix. Rule number 1, if the suffix starts with a vowel, you don't keep the ending vowel in the root word. For example, arthritis. Rule number 2, if a suffix starts with a consonant, a vowel is needed. Example, angioplasty. Rule number 3, if 2 or more combining root words are used, a combining vowel is needed. Example, gastroenteritis. Rule number 4, if the combining form ends with the same vowel the suffix begins with, one of the vowels is dropped. Example, endocarditis. Next, we will learn about terms that discuss increased rates and decreased rates. The word hyper indicates high, elevated, or above. For example, hyperthyroidism indicates a high thyroid gland activity. The word tachy also indicates increased rate and means fast or rapid. For example, tachycardia means rapid heart rate. Hypo indicates low or reduced or below. For example, hypothyroidism means low thyroid gland activity. The word Brady also means slow or reduced. For example, Brady is bradycardia, slow heart rate. In medical terminology, we have root words that describe color. The root word leuco describes white. Erythro is for red. Chloro is green. Cyano is blue. And melano is black. We have prefixes that discuss positions. For example, extra means outside. Endo and intra mean within. Inter is between. Trans is across. And peri equals around. We have 2 suffixes that discuss specialists. The suffix logi means the study or science of, and the suffix logist is one who studies or specializes. Can you find the name of the specialist that coordinates with each of these descriptions? A doctor who specializes in the diagnosis and treatment of diseases or conditions of the heart and blood vessels. A doctor who specializes in diagnosing and treating diseases and conditions of the skin, hair, or nails. A doctor who specializes in the diagnosis and treatment of brain, spinal cord, and nervous systems. And lastly, a doctor who specializes in the diagnosis and treatment of lung disease. All of our medical terms can be categorized as either anatomy and physiology, pathology, diagnostic procedures, and therapeutic interventions.